Alrighty, so we're just going to start off with a warm-up here on this side. So fascial stretch therapy is an assisted stretching method that targets not just the fascia, but also the nerves, muscles, and other connective tissues such as the joint capsule. It's based on primarily slow, gentle, rhythmic movements in order to soothe the nervous system and to establish that bond of trust with the client that allows them to relax into the movements that you're doing, which may be very unusual for them as they haven't been able to go into some ranges for potentially a long amount of time. So we start off with just really gentle movements, usually folks starting off with the hip as opposed to the shoulder, and seeing what kind of increases in range we can get happening there, and hopefully positively impacting the upper body once we make it to that range. And I'm just starting off just by testing Leah's possible range here and just seeing how much she's guarding as I move into a gentle stretch of abduction at this moment. It's not bad, so we'll move on to the next portion. Tractioning is a huge component of FST and is one of the biggest things that makes it different from self-stretching, just since once you have the traction motion, you take off a lot of pressure on the nerves, and it allows people to get into further ranges than they'd be able to achieve on their own, since they don't have that necessary as big of a pain response or the pinching, burning, compression that you may have when you're just trying to stretch against the door frame or sitting on the floor or whatever the case may be. Stretch wave is another huge part of FST, where you're just gently going into rhythmic movements as opposed to static stretching, and it tends to be a lot more enjoyable and relaxing for the patient as opposed to just staying in a single, very uncomfortable position the whole time. Is that okay here so far? Yeah, good. It's a lot of fun for the practitioner to do, since you're using your body so much instead of just trying to muscle through a lot of the movements with regular massage. And take a nice deep breath in and out. And in. And out. So you can see here as I'm doing this how much rotation is happening at the spine, even as I'm still focusing on the hips, which then leads to improvement when we move to the upper body, since you're already pre-warmed up and relaxed for that. So this is an area that I spend a huge amount of time in, stretching out the glutes and internal and external rotators of the hip. And this is where you typically get a lot of interesting expressions on people's faces as they haven't been in these positions for a long time, but you tend to get a lot of immediate relief. And once people stand up, get off the table, shake themselves out, like, you can just see how different their bodies feel to them. Or if you only do one side, then have them get up, comparing both sides, like they'll say very often, like, wow, this leg feels inches or a foot longer than the other one, which is fun to see. And so I can spend easily 10 minutes just focusing in on stretching the glutes here, depending how tight someone is. Hockey players are so much fun to do this too. And then I'll put a little bit more torsion on the knee to help target piriformis and other. You might get some pinching sensations here for people, so you really have to take your time, inquire if it's causing any kind of neurological symptoms here. Doing okay? Yeah. Yeah, so that's a brief summary of what an initial leg warm-up would be. And then if you're to move the upper body, you start off a lot of GH tractioning. Deep breath in and out. really surprised by how amazing something as simple as this feels. And you just really take your time with it. It looks gentle, but it can be really intense for a lot of people, especially those with chronic shoulder issues, a lot of guarding happening through here. And it's really useful as an assessment tool because you may expect someone to be tight in a particular range, but it turns out they're actually fine there, and then you'll go into a position like this and you'll be like, oh my goodness, like that hurts so much in that particular muscle, which standard active range of motion didn't show, and gives you a clue of where you should work next. And I'll just have you scooch closer to the edge of the table so you're right against my hand here. Perfect. And I'm just going to skip a few steps. We're going to go right into this stretch here. And this is a really fun one for the rotator cuff. Is that okay so far? And then we'll go in like that. And depending on someone's range and whether they're more limited in internal or external rotation will depend how intense this feels, but this is just a really amazing one for getting immediate results in terms of what someone's active range of motion looks like. And then you go the opposite way for internal rotation. All right, feeling okay?
Yeah.